office?
My first day in office, of course, is to familiarize myself with the office, but most importantly is to understand on how I will be able to formulate and legislate policy when it comes to healthcare. And it's a devolved function, but we can be able to formulate and legislate policies nationally, and that will be able to change the scope of how our healthcare system is operating. And it's important for us to realize it needs a wholesome approach.
Yeah.
With the devolved counties and, of course, the national approach in terms of how our healthcare system needs to be shaped. The doctor's welfare, patient to doctor relationship, and then, of course, medical insurance policies in this country. We also have the, universal healthcare cover. Is it really working? Those are things we need to start addressing, in that when a patient goes to hospital, they know that whether they have insurance or not, they can access emergency services.
You can probably answer that because you are a direct victim of such services.
Exactly. And you do understand that in this country today, if you go to hospital and it's an emergency, you do realize that you will not be able to access any healthcare services. Yet it's in the Constitution that you have a right to any medical care at the emergency level. But when you go to a hospital today, you have to pay. And we've lost so many lives at the casualties.
Yeah, so sad. You're talking about.
And how are we empowering the infrastructure in our local hospitals, even before you get to the level 5s and to the general hospitals? How are we empowering our clinics in our constituencies? You come to my constituency today, we don't have doctors, we don't have nurses, we don't have medication. You go to a hospital, they tell you to even go and buy syringes out there.
No.
Should that be the case?
No, I don't. Is that happening in Dagoretti South?
That is happening in Dagoretti South. That is happening in my constituency.
And health is devolved.
And health is devolved.
Health is devolved.
So what policies, that's why I'm saying that we need people who understand and people who've been through the system and understand what policies they can formulate and legislate in order for our healthcare system to change. And it needs people who've been through it and people who are going to fight. This is not going to be a sloganeering thing. No, that we're going to change. No. It needs to be an agenda. It needs to be itemized. It needs to be prioritized so that we can be able to see that change in our healthcare system. Remember, a healthy nation is a productive nation.